So, have you ever really stopped to think about what separates a psychiatrist from a therapist? Or maybe you've considered seeking medical mental health care but have no idea what to expect? Well, if that sounds like you, you've come to the right place. Today, we're going to decode the entire world of psychiatry and give you some clear, straightforward answers.
Look, we get it. Trying to navigate mental health care can feel, well, overwhelming. There's so much information out there. But it really doesn't have to be that confusing. Think of this as your roadmap. We're going to walk through the whole journey together, from understanding exactly who you're seeing to what actually happens in that first appointment. So let's start with the absolute basics. All right, let's get right to the heart of it. What is a psychiatrist? The whole answer, the thing that changes everything, hinges on one single word: medical. That one little word is what sets them apart from pretty much everyone else in the mental health field. So, at the end of the day, a psychiatrist is a licensed medical doctor. And that's not just some fancy title, it means they are a physician, just like a heart surgeon or a family doctor. They've just chosen to specialize in that incredibly complex connection between our brain, our body, and our mental well-being.
And becoming one is a serious journey. We're talking 4 years of medical school, and then, after all that, another 4-year residency that is completely focused on psychiatry. And it never really stops. They have to keep up with the latest medical research and treatments to make sure they're giving the absolute best care.
And this is exactly why that medical degree is so important. A psychiatrist can look at symptoms of, say, depression or anxiety, and they can ask a question that others can't. Is this purely psychological, or could something physical be causing it? I mean, things like a thyroid problem, a hormonal imbalance, or even a vitamin deficiency can all look exactly like a mental health disorder.
Okay, so that whole medical foundation, it leads us right to the question I hear all the time. How is a psychiatrist actually different from a psychologist or a therapist? Let's break that down, nice and simple.
The easiest way to think about it is like this. On one hand, you have the psychiatrist. They're the medical doctor. They're focused on the biology, the physiology of the brain, and they can prescribe medication. Then on the other hand, you have the therapist or psychologist. They are the experts in talk therapy. They use counseling and behavioral strategies to help you work through challenges.
Let's dig a little deeper here. You see, a psychiatrist is always a medical doctor, an MD or a DO, with full prescribing rights, no exceptions. A therapist's credentials, though, can vary a lot. And check out those last 2 rows, because this is key. A psychiatrist brings your physical health into the picture. They'll look at lab work. They can use medical protocols in a crisis. A therapist is focused squarely on behavior and would have to refer you out if medical help was needed.
Okay, so you've made the decision to see a psychiatrist. Awesome. But what happens now? Let's pull back the curtain on that first appointment, because I think that's the step that makes people the most nervous.
The absolute first thing you should know is that this meeting is going to feel a lot more like a doctor's visit than a classic therapy session. It's a clinical intake, and the whole point is to build a complete picture of your health, not just your mental health, but your physical health too.
And this process is super thorough, but for a really good reason. They're going to start with your entire medical history, not just the mental health stuff. They'll do a deep dive into your symptoms and might even order some lab work to rule out any of those physical causes we were talking about. It's only after they've gathered all that information that you'll work together on a treatment plan. It's a methodical way to make sure they're seeing the whole you.
Now that first evaluation, that's really just the starting line. The real goal is to create a living, breathing treatment plan that can adapt with you and support you on your path to wellness.
Which, of course, brings up a huge question. Is it just, one prescription and you're good to go? No way. Not even close. Real effective treatment is a process. So, how do they actually keep an eye on things over time?
It's all about partnership and adjustment. It means having regular follow-ups to see how a medication is working, watching for any side effects, and, this is crucial, making changes as your symptoms change. It's like a constant feedback loop designed to keep things on track.
A huge part of this is something called observational scanning. I know, it sounds super technical, right? But it's really all about the human connection. It just means that your psychiatrist is highly trained to pick up on subtle little changes in your mood, your energy levels, even the way you talk. These are all clues that tell them how the treatment is working and what might need a little tweak.
All right, let's tackle another super practical question people always ask. What kind of time commitment are we actually talking about for these follow-up appointments?
And the answer is actually pretty straightforward and reassuring. Right at the beginning, when you're just starting a new plan, you might see them every few weeks, just to get everything dialed in perfectly.
But once things are stable and you're feeling good, those appointments usually stretch out to every few months, more like a check-in to maintain your progress.
So, we've talked about the medical side of things, but what about all the practical stuff? Because for a lot of people, the biggest hurdle isn't the appointment itself, it's figuring out the insurance.
And here's some really good news. Thanks to federal law, most health insurance plans have to cover mental health care at the same level they cover physical health care. It's a concept called mental health parity, and honestly, it's been a total game changer.
But, and this is a big but, parity doesn't mean you can just skip your homework. Before you book anything, it is so important to call your insurance company and ask these 3 specific questions. Is this doctor in my network? Do I need a referral first? And what exactly are my pharmacy benefits? Getting those answers up front can save you from some massive headaches later on.
You know, as we start to wrap this up, it really all boils down to this one idea. Deciding to see a psychiatrist isn't just another option. It's a very specific and powerful choice to seek a medical perspective on your mental health.
And that's really the big takeaway here. Psychiatry makes sure that the entire picture is being looked at. Your biology, your brain chemistry, your physical health, it all becomes part of the equation for your mental wellness. It is a truly complete approach.
So, I want to leave you with one final thought. After everything we've talked about, what's the one question you can ask or the one action you can take today to move forward on your own health journey? Maybe it's asking your doctor about a symptom, or maybe it's just making that call to your insurance company. Whatever it is, remember that knowledge is always the best first step. Thanks so much for joining.